Falls are harmful and can occur in any age group at any time. While in the hospital, everyone is at increased risk for a fall. Patients are often in unfamiliar surroundings. They may be weak from illness or surgery. Medications can make them dizzy or unsteady. This makes them vulnerable to falls. Falls can have serious consequences. They can lead to broken bones, head injuries, and even death. For older patients, a fall can be life-altering, leading to a loss of independence. The fear of falling can also make patients anxious and hesitant to move around. This can hinder their recovery. The risk of falling is a serious concern for hospitals. It is a major patient safety issue. Hospitals are constantly working to prevent falls and create a safe environment for their patients. This requires a team effort from doctors, nurses, and other healthcare professionals. But families and patients themselves play a crucial role too. By understanding the risks and taking precautions, we can all work together to prevent falls. Many factors can increase a patient's risk of falling. Some are related to their medical condition, others are related to the hospital environment itself. Age is a major risk factor. As we age, our bones become more fragile and our balance deteriorates. This makes us more likely to fall and more likely to be injured if we do. Medical history also plays a role. Conditions like heart disease, stroke, and Parkinson's disease can affect balance and coordination. Medications are another important factor. Some medications, like painkillers and sedatives, can cause drowsiness or dizziness. These side effects can increase the risk of falling. It is important to be aware of the potential side effects of any medications you are taking. Difficulty moving is a clear risk factor. Patients who have trouble walking or who use mobility aids like canes or walkers are at increased risk. Muscle weakness, joint pain, and neurological problems can all contribute to mobility issues. Preventing falls in hospitals requires a multi-pronged approach. It starts with identifying patients at risk. Nurses and doctors assess patients when they are admitted. They ask about their medical history, medications, and any previous falls. They also observe the patient's balance and gait. Patients and their families need to be aware of the risk of falling. They should be told about the precautions in place and how they can help. This includes keeping the call button within reach and asking for assistance. Hospitals use several strategies to prevent falls. Non-skid socks provide extra traction on slippery floors. Gait belts give staff a secure way to assist patients. Bed and chair alarms alert staff if a patient tries to get up without help. Nurses make rounds frequently to check on patients and offer assistance. Keeping the environment clutter-free is also important. Pathways should be clear of obstacles and rooms well lit. Section 4, the assisted fall, a case study. On August 29th, I witnessed an assisted fall. An elderly patient recovering from a stroke needed to use the restroom. He was weak on one side and required assistance to walk. The nurse, though well-intentioned, was not using a gait belt. As the patient stood, he became unsteady. The nurse, caught off guard, tried to support him, but the patient's weight shifted and they both lost their balance. The nurse, unable to prevent the fall, guided the patient to the floor. Thankfully, the patient was not seriously injured. But the incident was a stark reminder that even with the best intentions, falls can happen. It highlighted the importance of proper training, adequate staffing levels, and consistent use of safety measures. Section 5. Learning from the fall, the SORT tool. Every fall is a learning opportunity. We can use these incidents to improve our systems. One tool that can help is the SORT tool. SORT stands for Stop, Observe, Reflect, Teach. After a fall, ensure the patient is safe. Then gather information about what happened. Next, analyze the contributing factors. Finally, use what we learned to teach others. The SORT tool highlights areas for improvement. The nurse may benefit from a refresher course. Consider implementing a policy requiring gait belts. By analyzing falls, we identify patterns and trends. This allows us to make meaningful changes to improve patient safety. Section 6. Striving for zero falls. Falls in hospitals are a complex issue. They are often the result of a combination of factors, but they are not inevitable. By understanding the risks, implementing proven prevention strategies, and fostering a culture of safety, we can strive to achieve zero falls. This requires a commitment from everyone involved in patient care. It means empowering patients and their families to be active participants in their safety. It means providing healthcare workers with the training, resources, and support they need to provide the best possible care. Ultimately, preventing falls is about more than just numbers. It is about preserving the dignity, independence, and well-being of our patients. It is about creating a healthcare environment where everyone feels safe, respected, and cared for.